Hello, friends and colleagues, and welcome to episode 114 of Dermasphere, the podcast by dermatologists, for dermatologists, and for the dermatologically curious. I am one of your hosts. My name is Luke Johnson. I am a pediatric dermatologist and general dermatologist with the University of Utah. And every 2 weeks, Dermasphere comes to your ears with discussions of some of the latest research in the world of clinical dermatology so you can feel up to date just by listening to us, we hope.
If you want to think about memory, we could talk about Memantine, which is a drug that we use by the brand name of Namenda to treat dementia patients, but it may have a new use. Spoiler alert. So, this is an article outside of our literature from the Psychiatry Online org journal, and this is entitled
American Journal of Psychiatry, I think.
American Journal of Psychiatry sounds better. Double-blind, placebo-controlled Memantine in Trichotillomania and Skin Picking Disorder by chief authors John Grant and Samuel Chamberlain. The trichotillomania and skin picking disorders are underrecognized and understudied. They can be disabling and they cause patients to repetitively pull at or pick at their hair or skin, creating noticeable cosmetic damage. There's a paucity of evidence for treatments for these patients. In this study, the authors are actually looking at memantine, which is a glutamate modulator, and were able to determine that it was more effective than placebo in reducing hair pulling and skin picking behavior. They had 100 adults with trichotillomania or skin picking disorder, 86% of which were women, average age of about 31 years, in this double-blind trial of memantine dosed from 10 to 20 milligrams per day or placebo for 8 weeks. The participants were assessed with numerous measures I'm not going to delve into too much detail about because they're more psychiatrically relevant than they are dermatologically relevant. But generally, they're measurements of the degree of impairment that the condition causes for the patient, the amount of distress that it causes, or functional impairment, and the patient's ability to interfere with the impulse behavior of either pulling the hair or picking at the skin. So they looked at this with numerous different measures and were able to determine that there was significant improvement. About 60.5% of patients in the memantine group were much or very much improved, compared with only 8% in the placebo group. So the number needed to treat to give improvement was only about 2 patients, which is a pretty low number needed to treat for a therapeutic that's as benign and inexpensive as memantine is. So in the memantine treatment arm, there was a statistically significant reduction in hair pulling or skin picking symptoms compared with placebo, with relatively high efficacy and very good tolerability. So the glutamate system may be a target for the treatment of compulsive behaviors. And I was wondering if this might also be something beneficial to look at for patients that have delusions of parasitosis or prurigo nodularis with skin picking. So I think that this might be expanded into other areas of dermatology. The primary treatment for trichotillomania or skin picking disorder at this time is behavioral therapy. And there have been controlled studies on things such as habit reversal, which has 4, or if it's simplified, 3 components that involve sensitization and awareness. So rising to the awareness that there are signals or behaviors or environments that stimulate the behavior to occur. Like, I'm getting stressed, my hands are on my hair, I'm about to pull my hair, getting that sort of awareness piece there. And then creating a competing response. And the competing response is an alternate activity that is incompatible with the habit. So, for example, with hair pulling, one of the competing responses that patients can use is to make their hand a fist and to put it on their side, because you cannot pull your hair if your hand is in a fist and on the side of your body. So finding an alternative activity to do with the part of the body that you're predisposed to have that repetitive unwanted behavior. And then habit control motivation or generalization training, which can be simplified into social support, having a family member or somebody in their social sphere help the patient to become aware of the behavior and to help remind them to engage their competing response. So those are kind of some of the tenets of typical treatment at this time. Acceptance enhanced behavior therapy is a combination of this habit reversal treatment along with stimulus control, which means to decrease the environmental variables that increase the likelihood of the behavior you're trying to decrease. So if people are more likely to bite their nails when they're watching television, then changing that behavior. And then acceptance behavioral therapy is accepting the life experiences as they come to you without trying to judge them. So teaching the patients to be non-judgmental of this behavior. This is something that may actually even have neurobiological motivation behind it. Interestingly, in this study, they looked at some MRI studies and were able to determine that there were some white matter changes that suggested disorganization of white matter tracts in the motor habit generalization in the motor tracts. So the patients might have actual white matter changes that contribute to these behaviors that could potentially be modified by controlling the glutamate pathway. And in animal data, they have some models where they have mice that have knockouts. It's SAPAP3 knockout mice, but they have a atypical compulsive grooming behavior. And the SAPAPs are proteins that act between glutamate receptor binding proteins and the cytoskeleton. So in these knockout mice, glutamate modulation was able to decrease the compulsive grooming behavior, giving some sort of basic science support that this might actually be beneficial. So that was one of the reasons that memantine was looked at as a potential therapeutic agent. I thought that that was kind of an interesting fact. Now, memantine has not been studied in pregnancy, so the patients they included in this study had to be on appropriate contraception to avoid the possibility of an affected pregnancy. When they looked at these patients, they had some baseline comorbidities, which are not unexpected in a patient that has a compulsive behavior. So, in both the placebo and the experimental group, about 60% of patients had at least one co occurring disorder, including major depressive disorder, anxiety disorder, or PTSD. Many of them were also undergoing psychotherapy in both the experimental and the control groups. Interestingly, the psychosocial comorbidities were more severe in the patients that were in the treatment group. So that was a harder group to achieve benefit in, but they still outperformed the placebo group. So I think that's good evidence that the patients actually did achieve improvement. Dropout rates were similar between both groups, indicating a likelihood that side effects were not motivating patients to stop using the medication. Dizziness was the only side effect that was isolatable to the active therapy. When patients were looked at by all these numerous psychiatric scales that are very important in their literature, and I have great respect for them, but will not delve into detail, they were able to find meaningful improvement in 4 of them, all of which assessed the presence of the behaviors and the impact of the behaviors on the patient's life. They did have some patients that had severe scores on the scale, the NIM scale. Like it's NIM is National Institutes of Mental Health, which is the organization from the rats of NIM. Theoretically, it was a fictional organization in that particular work from 1971, but it has got the exact same name and basically does the same thing. So I don't know if it really was fictional or if they were just hippies mad about rats getting experimented on.
That was
But
a creepy movie.
that movie gave me such bad nightmares. But even patients who had the most severe scores on this NIM scale, indicative of severe illness, had 75% response rate to memantine. So that was a pretty significant improvement, even in the most severely impacted patients. And, there's evidence in our literature also that the glutamate pathway may be impacted because we have previously published data about N-acetylcysteine and its efficacy in helping reduce the behaviors of trichotillomania. We discussed the use of N-acetylcysteine way back. Hold on, I'm trying to find my first page where I have this.
Yeah, it was
In
a long
episode
time
8.
ago.
Episode 8 of Dermasphere, where we found in that article that 1,200 to 2,400 milligrams per day of N-acetylcysteine was beneficial in reducing compulsive behavior such as trichotillomania in dermatology patients. And so the treatment, memantine, has also been studied in the treatment of obsessive compulsive disorder and has been found to be helpful in augmenting first-line interventions in those disorders. There was also no evidence of harm in this study in the patient experimental group, and the effect size for memantine was 1.76, which is comparable to the standard behavioral therapy that's typically used in those patients and superior to things such as olanzapine and clomipramine, which only had effect sizes of 0.94, 0.69. N-acetylcysteine, which has been found to be beneficial, had an effect size of 1.05. So memantine appears that it would be potentially more therapeutically efficacious for patients that have trichotillomania or skin picking disorder. I think that this was well presented evidence that this could be a beneficial medication for these patients. Of course, you have to consider the potential side effects of any drug that you're utilizing to treat something. Memantine has a relatively benign side effect profile. The most serious side effect is dizziness, or the most common side effect is dizziness. It can also cause bloating, can cause headache, nervousness, can cause weight loss or gain. Patients need to be assessed for any kind of disruptive side effect, but there's no evidence of long-term danger in taking the medication. and it can be used for many, many years in patients with its primary indication of dementia without evidence of harm. They usually stop Namenda or Memantine in patients with dementia if the side effects are outweighing the benefits, which is, how we should manage most medications. But I thought that this was very promising, and I think that there are other areas of dermatology that this could potentially be beneficial in.
It's also cheap.
Mm-hmm.
I looked it up
Inexpensive.
and found the most expensive number for a month's supply was $90, and the least expensive was $3 for a month's supply of this stuff. So, do I feel comfortable enough that I can just prescribe this tomorrow and say, hey, there was this cool article. It looks like a pretty safe drug. It's pretty cheap. Give it a try. I've never prescribed it. I almost never have thought about it. Do you feel like you've got a pretty good handle on the side effects and feel like, yeah, they're safe enough, I can just go ahead and do this?
I actually have a plan with this that I want to cautiously step into the world of utilizing this for some of my patients that already have a psychiatrist as a part of their care, and discuss the appropriateness of the therapy with that psychiatrist, ensure there won't be any interactions with any of their psychotherapeutics, and kind of co-treat them together to ensure there's no destabilization of any kind of coexisting neurologic or psychiatric disorder. But I actually think that the safety behind this is pretty reputable, and trichotillomania and skin picking can in some patients be relatively debilitating behaviors, so I think it's something that bears further investigation.
That's a good idea. And even patients who don't have a mental health provider, maybe you can just talk to their PCP. I bet PCPs know a lot more about this than I do. I don't know about pediatricians. I'm guessing they don't do it very often, but if it's sometimes used for OCD and stuff, then maybe.
Hmm. I think it's a very interesting concept, and the glutamate axis and the fact that there might be actual white matter changes makes sense as to why something like N-acetylcysteine would be beneficial as well. So I think that the existing evidence supports the hypothesis that the glutamate axis might be out of order in these patients.
I thought N-acetylcysteine worked by scavenging free radicals, which were somehow a problem.
It does do that, but there is some effect on the glutamate axis as well. I don't know if we have time to delve into the like deep.
We
Uh...
probably don't. I'm willing to take your word for it.
Okay.
All right. Well, that is probably all the time we have today, guys. So thank you so much for joining us. So today we learned that you should be careful about those UV lamps in nail salons. We learned about cantharidin for molluscum, now approved, but very expensive. On the plus side, looks like it works. I mean, better than placebo, anyways. We learned about neoadjuvant imiquimod for lentigo maligna, especially with staged excisions. We learned about TNF inhibitor-induced psoriasiform eruptions in children. Hopefully you can treat through with topicals. And I always mispronounce it, I guess. Memantine can potentially be
Memantine.
helpful for people who pick at their skin or hair.
Hmm.
Thanks to our institutions, thanks to the University of Utah for supporting the podcast, and thanks to Texas Tech for lending us Michelle. Thanks also to the members of Team Dermasphere who do a whole lot to help keep this moving along. Thanks to Morgan Dykman, Guy Kusecki, Eleonora Morcacci, Michael Birdsall, and Lara de la Cruz. Sorry, I was doing that off the top of my head. One thing you guys do is keep our social media accounts moving along. So you can find us on Instagram, Twitter, and Facebook. You can also find us on our website, dermaspherepodcast.com, which has links to all of the original articles we discussed, and it also has our entire archive. Any of these ways are good ways to reach out to us and say hello. Thanks again for hanging out with us today, listeners, and we'll see you in 2 weeks.